Hi everyone, it's Dr. Hall, and we're going to do the liver and gallbladder today. And so I just want a word of warning when you're looking in your dissector or in your atlas. The liver is a very large organ with multiple different surfaces on it, with lots of different structures found on those different surfaces. So pay a lot of attention to what view they're showing you, because otherwise it gets really confusing very quickly. So we're going to start with the liver. So it's a vaguely triangular organ and quite large and quite thick. It's a solid organ, so we're not going to go into depth in terms of the interior anatomy of the liver, but in terms of the structures on the outside, there's quite a lot going on. So we have on the inferior surface of the liver, I want you to kind of make almost like an H or almost like a spider, kind of an hourglass type shape, because that's going to divide the liver up into its 4 lobes. So we have the left lobe of the liver, that doesn't show up very well, left lobe of the liver, right lobe of the liver. Towards the front, we have the quadrate lobe, right? So it's part of a quadrant, it's one of 4, the quadrate lobe. And then in the back, we have the caudate lobe. So you can remember that because cauda means tail. Remember, like cauda equina, tail of the horse, and that feature of the spinal cord. So caudate is the posterior one because cauda means tail. So quadrate, caudate, left and right. Now, there are going to be various different structures that we're going to find in these different grooves in between. So the first thing I'm going to add, actually, that we're going to find right here, and actually integral to the structure of the liver itself, so I'm cutting out space, we're going to find the inferior vena cava. So the inferior vena cava travels through the liver. In fact, when we remove the liver from the human body, we have to cut the inferior vena cava to bring that out with it. So the inferior vena cava is going to be receiving blood from the liver via the hepatic veins. Okay, so it's going to be draining blood from the liver into the general circulation via the hepatic veins, which we can see here, and you can usually see some from the superior surface as well. Okay, so that's the most posterior structure of the liver, is going to be our inferior vena cava. Again, this is the inferior surface of the liver. So we're going to add a few more structures here on our inferior surface. Let's see if I can just kind of, okay, good. So this is also where we're going to find the hepatic portal vein entering the liver. So you might remember the hepatic portal vein is bringing all of the blood from the digestive system, from the intestines, the stomach, the spleen, and it's bringing it into the liver basically for processing, okay, because this has all the nutrients and toxins perhaps that you have just ingested and absorbed. So when we look at the portal venous system for the liver here, we've got the inferior mesenteric vein that's primarily draining the left side of the large intestine, the splenic vein, and the superior mesenteric vein that's bringing the blood from the small intestines and the right side of the large intestine. So this is going to enter into the liver kind of towards the middle left side of that H. Okay, so it's going to come into the liver about there. I think you can see that. All right. Along with that, there are other structures entering the liver. So one of them is going to be our arterial system. So this is the hepatic artery proper that you might remember came off of the common hepatic artery. And so that has several branches. You've got your left hepatic artery, your right hepatic artery, and coming off the right hepatic artery, a little tiny artery going to the gallbladder called the cystic artery. So I'm going to put that in place here. And then most anteriorly, we're going to find the bile duct system. So similarly to the arteries, we're going to have a left hepatic duct, a right hepatic duct, and coming off of the common bile duct or the bile duct itself, we're going to have the cystic duct, which is actually draining bile from the gallbladder. So I'm going to go ahead and put that in place. So we have these 3 structures the arteries, the bile duct, and the hepatic portal vein all entering the liver at the same spot. And so this is called the porta hepatis, right? So a port is like a shipping port, right? You're bringing things in and out. And so this is where there's a lot of activity, a lot of things going in and out. So we've now introduced the biliary system with our common bile duct, cystic duct, left and right hepatic ducts. Let's add the gallbladder itself, which is going to sit in a fossa or shallow depression right here on the right side. I'm going to hook it up to my cystic duct, hopefully. Okay, good. And so the gallbladder has three parts. The kind of top of the gallbladder, which is the most anterior structure, is the fundus. Then we have the body. And then as it narrows, as it comes toward the cystic duct, it is the neck of the gallbladder. All right. We have a few more structures here, and these are going to be souvenirs from our fetal life, okay? So when we were in utero, we of course were getting all our nutrients and oxygen from the placenta. That came into the fetal body through the umbilicus in the umbilical vein. Now you're like, this does not look like a vein, Dr. Hall. That's right, because after we're born, that obliterates and becomes the remnant of the umbilical vein, which we call the round ligament of the liver. And we're going to find that in that left, or the left side of that anterior H. So the round ligament of the liver here. And then that continues back posteriorly and ends up entering into those hepatic veins, which I didn't make quite large enough, because that blood, when we were fetuses, came in through the umbilical vein and then drained into the hepatic vein and into the inferior vena cava. So this is the round ligament of the liver, and this part right here has a different name. It's called the ligamentum venosum. So very much like the ligamentum arteriosum, but this is the ligamentum venosum. So these both carry remnants of the umbilical vein that then drained into the hepatic vein and into the inferior vena cava. Now, this round ligament of the liver is found within a fold of parietal peritoneum called the falciform ligament. And that comes off of the liver like so. So I'm going to move it into its normal anatomic position here. And it's this broad sail-like ligament that hangs off of the anterior abdominal wall, right? That's the falciform ligament. And it also ends up dividing the left and right lobes of the liver. If we look at the superior surface of the liver, we will also find the coronary ligament, like so. So posterior to the coronary ligament, there's my smushed inferior vena cava, and we have this bare surface of the liver that's not covered by any visceral peritoneum. The rest of the liver is covered by visceral peritoneum, but it reflects up on the superior surface of the liver to become the coronary ligament. All right, so I've made a little bit of a mess of things, but I think they're all still here. We have a few more arteries to add to be proper. Hepatic artery proper, right? And then I have my left and right hepatic arteries. Everybody did get a little squished. Let me fix that. Okay, so left and right hepatic arteries and cystic artery. I've just removed my bile ducts for easy viewing. And you'll probably remember that the hepatic artery proper was a branch off of the common hepatic artery, which was one of the three branches off your celiac trunk. So here's my common hepatic artery, sends off the hepatic artery proper, and then the rest of it continues down inferiorly as the gastroduodenal artery there. We have one final artery to add that comes off the hepatic artery proper, and that is the right gastric artery, which is then going to travel along the lesser curvature of the stomach. Let's see if my light, if I can improve the lighting a little bit. I don't know. Okay, so let's do a review because that's a lot of structures. So we had the coronary ligament on the superior surface of the liver. We have the falciform ligament coming off the anterior surface of the liver, and in the free edge of it, we find the round ligament of the liver, which then travels here and then turns into the ligamentum venosum. These are remnants of the fetal umbilical vein. Going to reposition our bile duct system. Okay, so we have our gallbladder with the fundus, body, and neck. We have the cystic duct draining bile out of the gallbladder, and the right and left hepatic ducts draining bile out of the liver. Again, hepatic artery proper, left and right hepatic arteries, cystic artery coming out to the gallbladder. Here is our hepatic portal vein, which is receiving blood from the splenic vein and the inferior mesenteric vein. So splenic vein and inferior mesenteric vein and superior mesenteric vein. Back here we see the inferior vena cava with the hepatic veins draining into it. That's going to be present on the whole posterior surface of the liver. It got pretty squished. Okay, so that is liver and gallbladder, and I'm going to do duodenum and pancreas as a separate video because this is a lot of pieces. All right, thanks.